The Quadratus Lumborum block, also known as the QL block by Gada Al-Salahdar and Arnold Navarro.
The QL block is a regional anesthetic technique that provides somatic and, to an extent, visceral analgesia to the abdominal wall. The quadratus lumborum, or QL, muscle is the primary sonographic landmark, hence the name. It is a posterior abdominal wall block. The local anesthetic spread between the QL muscle and the thoracolumbar fascia, which is close to the paravertebral space and subsequently may explain the more extensive analgesia and prolonged duration of action. It is a unilateral peripheral nerve block that can be done bilaterally. This depends upon the surgical procedure. Examples include a laparoscopic surgical procedure or those with a midline incision. The QL block is a component of multimodal analgesia. It can decrease opioid consumption and subsequently their associated side effects, ultimately leading to improved patient outcomes, patient satisfaction, decreasing lengths of stays, and overall enhancing recovery after surgery.
Approach. There are 3 QL block approaches, and small modifications in the needle insertion site can result in clinically significant differences in abdominal analgesia. For the QL1 block, the local anesthetic is deposited at the anterior lateral aspect of the QL muscle. For the QL2 block, the local anesthetic is deposited between the posterior lateral aspect of the QL muscle and the thoracolumbar fascia. The QL3 block, also known as the transmuscular QL block, this site of injection is through the QL muscle to the bordering side of the psoas muscle.
Indications. The block relies on the injection of local anesthetics to block the nerves that innervate the anterior lateral abdominal wall. The QL block is indicated for a number of general, gynecologic, and urologic abdominal procedures. Some examples are listed. Additionally, there is some utility for this block for postoperative pain management after hip surgeries.
Contraindications: patient refusal, infection at the site of injection, and allergy to local anesthetics.
This is a list of equipment needed to perform the QL block.
The QL block can be performed after induction of anesthesia or in the post-operative setting. The block can be done in a supine position, supine with the patient's hip elevated, or the lateral decubitus position. We will be demonstrating the ultrasound-guided QL block in the lateral decubitus position. First, place the patient in a lateral decubitus position. Next, position your ultrasound on the opposite side of the site for the block. Determine whether a linear or curvilinear probe is most appropriate for your patient. This is determined by the body habitus of the patient, such as a pediatric versus an adult patient. Then perform a timeout confirming a valid consent, allergies, correct patient, and correct side.
Next, use an aseptic skin preparation. Don sterile gloves, prepare your sterile field, place sterile ultrasound covering gel, prime needle and tubing with the syringe of local anesthetic. Check the orientation of the ultrasound and ensure that the right side of the probe is on the right side of the ultrasound screen. Then place the ultrasound probe on the posterior axillary line parallel and superior to the iliac crest. Identify the sonoanatomy: subcutaneous tissue, EOM, IOM, which is usually the thickest layer, and the TAM. Below the TAM is the peritoneum and you may note bowel peristalsis. Follow the EOM posterolaterally until it tapers off. Identify the QL muscle.
Advance the needle using an in-plane view in order to maintain constant visualization of your needle and the tip of the needle. Perform an aspiration test to prevent inadvertent vascular or peritoneal penetration. The test should be negative for blood and air. Inject local anesthetic slowly. It will appear hypoechoic. Note the hydrodissection of the local anesthetic as it separates the muscle layers. Perform the aspiration test after every 5 milliliters or each time the needle is moved. Remove the needle after the appropriate dose of local anesthetic is deposited.
This image shows the different approaches between QL1, QL2, and QL3. Additionally, the QL block can be performed with the linear probe and the patient in supine position.